hear from Dr. Sicily that it's helpful for PTSD. It is helpful also for social anxiety. They looked at patients who, in a placebo-controlled trial, about to speak, like I am. It probably wouldn't be helpful for me right now. But when people are speaking, that they're less anxious and they can use it. It's helpful for patients using depression scale, so they can do the depression scale and see the symptoms are less. And it's helpful for mood stabilization and bipolar disorders. Schizophrenia, we went over already. ADHD, it improved grades and it improved study habits in patients with ADHD and with PTSD as well. So the glaucoma, we talked about that. And anandamide, which is our own endocannabinoid that we make, the bliss molecule, is metabolized into prostamides. And prostamides are what we created synthetically to treat glaucoma as drops, and that's why it helps. It does decrease the intraocular pressures by increasing fluid outflow. Your eyes, the pressure and the flow can increase, and that's what decreases that pressure. So these were two studies that I put up there just so I can show my colleagues that it does reduce the intraocular pressure in the eyes, and it's a vasodilator, which means that it makes the blood vessels dilate and open up, and that's what causes the red eyes. And then as it increases the outflow of fluid out of the eyes, that's what causes the dry eyes. And so those dry eyes and red eyes that you get from cannabis, that's the reason why, and also it's healthy for the glaucoma. This is really interesting. So a pharmacologist in Jamaica found out that fishermen said that when they used cannabis and they smoked cannabis or they made rum out of cannabis and they drank it, they felt their vision was better. And so at nighttime, to go through the waters and go through those coral reefs, they said, no, my vision's better if I smoke cannabis. And so this pharmacologist in Jamaica had written about this, and Dr. Russo studied this in Moroccan fishermen and did actually dark adaptometry and scotopic sensitivity testing in a double-blinded study and showed that oral THC and smoked cannabis does improve night vision. So it does help for fishermen. So, it's helpful for so many diseases, but inflammatory bowel disease, it decreases spasms, it decreases pain, it improves nausea and vomiting, it improves the number of stools per day if they're constipated, and it does help with fatigue, and it helps with depression. Patients who go through symptoms of inflammatory bowel disease or many other illnesses, they develop depression. And I will say that in my practice, I see about 30 to 40 patients a day, and probably 10 to 15 of those patients do have symptoms of depression or anxiety. Sometimes it's just that, but many times it's related to their other illnesses or many other things going on in their lives. And so I really do believe that cannabis can be helpful for wellness and be helpful for many different illnesses. Whether we have research or not, we know that patients tell us that it is helping. There is data out there for many different things. It improves quality of life and improves the symptoms, and we can measure it by the clinical effects by doing surveys or looking at patients. So an area I think that's going to be very interesting in the future is going to be use of cannabis in cancer. We said it helps with the chemotherapy-induced nausea and vomiting. It helps patients with appetite and the weight loss. And it does help with peripheral neuropathy. So chemotherapy and those agents can really harm the nerves. So a lot of patients will have numbness in their fingers and their toes, and cannabis has been found to reduce the incidence of developing that. So it is a neuroprotectant. It protects those nerves and protects them from being damaged by the chemotherapy. And it helps with the pain for sure. But what we're seeing now is that it's being used in animal models, so in research in mice, not in a lot of human research data that's available, but that it's helpful for lung cancers, breast cancers, colorectal cancers, pancreatic cancers, thyroid lymphoma, and there's a lot of studies with it in gliomas or brain tumors. The CB1 and CB2 receptors are throughout our body, but it's in our immune system, it's in our nerves, and so it makes sense why it can reduce, to me anyway, it makes sense why it can shrink these tumors, especially the brain tumors. And I think that what I've seen that has been the best data has been its use for brain tumors. I had seen just a case study of a child who had an eye tumor, and the parents did not want to go forward with the surgery and the treatment, so they used cannabis oil and put it in the child's eye daily, multiple times a day, and there are MRIs that show that tumor shrinking. So it's, it's a one case study, but we just don't have the research. The research is not available for these long-term studies, but there are case studies that show that it is effective. So it does have its side effects. A lot of it is mild, and a lot of it is similar to the sleepiness, the dizziness, and it is associated with the dose. So the higher dose, there's more side effects. And there are more side effects when you use it in conjunction with alcohol or other sedatives, or if the patient's dehydrated. So cannabis use disorder, this is a disorder where patients feel like they do need it, or we talk about it being addicting, and Dr. Herger rather said, there's that 9% that I hear about or I read about. But patients, when they withdraw from it, the symptoms are very mild. It's similar to caffeine withdrawal. So sometimes it's just, maybe feeling tired or a little crabby, or a little irritable because they need their cup of coffee in the morning. So the cannabinoid hyperemesis syndrome. So I have seen this. I've seen this in the hospital, and there are certain patients, I think, who are going to be predisposed to this. But when we see patients come in with nausea and vomiting, and we do all the testing and we cannot find out the reason, sometimes we have patients stop the cannabis and then it does go away. And so there is a lot of new literature looking at patients scaling down or stopping for a period of time, washing out and starting back up. And this whole new avenue of microdosing and using it at the smallest amount that you need it, maybe the future, and that's the way to go. The reason I think that it's going to be so important for physicians and pharmacists and the healthcare staff here in Missouri to understand is because there are some interactions with other medications, because it does go through the liver, and we have this system called the cytochrome P450 system. So I really do hope that as you go forward, be very open to your physicians that you are using this, have them understand, have them learn so that they can help you and we can roll this out here in Missouri in a safe way. But I am voting yes on 2, I'm voting no on 3, and I'm not sure about Prop C. I'm probably going to vote no on Prop C too. But I really do implore you to tell your friends, tell people, and have people get educated and go out and vote, because Missouri needs this. My patients need this. And it's not a Republican issue or a Democratic issue. It's a patient issue. It's a human suffering issue. My patients cannot wait another 2 years or another 4 years for this to pass in Missouri. It really needs to come. And it's not just Missouri, other states around the country. But I have heard from people who are out there speaking to legislators that if we here in the Midwest go, hopefully the whole country will go. So we really need to be the heart of the country and get this passed. So many of you here probably have been in other states, so you've seen this. But when I talk to other doctors, what's going to happen? So they're going to need to certify their patients. Patients will get a card.
My medical card does not have a
go
picture.
to a dispensary. And I know other doctors are worried about what a dispensary looks like, but to me, I've been to a few of them, and they're just like any other store. They're going to be like a makeup counter or like a regular pharmacy. So I assure them that it's not going to change the landscape of the city too much. But there are different delivery methods, and these are things that I think patients here will hopefully have the option of using it in various different ways. I've seen where some states it's only oils, and I really do hope that there's going to be different ways of administering here in Missouri. And recommendations of dosing, what I hope is the Missouri Cannabis Trade Association, we can help to educate physicians so that they can educate their patients, but then also educating the patients about starting slow, about dosing, and making sure that patients are using it safely. That's really starting slow and going slow is going to be important. Patients are going to have to figure it out themselves. You know, with other medications, I can tell people take 1 a lead, and if that doesn't work, take 2 a lead, and I can tell them to increase over time. This will be the same way. You're just going to have to start very slow, but doctors aren't going to understand. So you're going to have to kind of understand yourself and figure it out yourself, and hopefully we will have this available for dispensaries to educate their patients as they come in. But these are more for the doctors to understand what it means to certify a patient, and that in other states where the physicians would have to apply in order to write for patients. So this I just thought this fun. I just saved my liver by switching to medical cannabis. So, so thank you